Well, hello, family. This is Pastor Courtney Meadows, and I know that it is unusual for you to see us broadcasting on a Tuesday, but we are living in unusual times where our faith has been tested in so many ways, specifically due to COVID-19, its initial impact, and now we are yet feeling it again in a special way here in Alabama, in the city of Montgomery. Wherever you are, you're feeling it. Your family are being affected by it. Members of your community, we're living in a time where most people don't know somebody that has been affected by this pandemic. I mean, it's just very rare that you don't know somebody that's been affected, whether they've lost their life or whether they are a survivor or actively battling this thing. And you could even be that person. What do we do as people of faith? As a pastor, I've had to ask myself time and time again, what do we do? And the resolve is we cannot stand idly by and do nothing. Through the blessing and benefit of partnership with an organization, a collaboration known as Choosing Healthy Living, based out of New York, collaboration of pastors, and has now grown and evolved into so many states across this country. We are now a part of churches that are going to actively push vaccination efforts, education, clinics, PSAs, so many other things of which you will hear about. Specifically here at Hutchinson, we've decided to incorporate into our food giveaway held each month a COVID clinic. And additionally, we're going to be doing so many other events and by way of education. We're going to have a COVID team of which you will hear from. I mean, I am really committed not to sit idly by. It's just like Esther, Mordecai, her mentor, said to her, God's going to do his work amongst his people. But the question is, will you be a part of it? And then he says, could it be that you were appointed into the kingdom for such a time as this? And I want you to know that we are doing our part, Hutchinson. We're connecting with other churches, and we'll share more about the partnership. But one of the things that we are going to do beginning right now is initiate our COVID conversations, tackling various myths, helping to address your questions and concerns in partnership with various medical professions. We want to hear stories of survivors. We want to help you to understand how your faith can be displayed even not only in believing that God will see you through, but you doing your part. That's the question of our faith. Do I not take the vaccination because, God was calling the roll and I was next on roll anyway, and my death could have been prevented, but I just believe it was my time or somebody else's time? Some people say, we're going to die anyway, God just using COVID. All of this craziness. God's sovereignty has always partnered with human responsibility. All good and perfect things come from the Father, and nothing happens without God allowing it. And throughout the span of time, plague after plague in Scripture, God had solutions to save his people, of which sometimes they were skeptical, questioned, mumbled, grumbled. But when they did it, they were saved and spared. And I believe that consistent with times past, God wants to help his people. And one of the most modern miracles is the power of science. Think about it. Some of the stuff that people faced in the Old Testament, now, by way of medicine and scientific technologies and advancement and understandings, we no longer need pastor to lay hands. We just take the medicine, go through the treatment, get the surgery. That's one of the greatest miracles, because Jesus promised that we would do greater works, and science is a part of that. And so we're going to have segments each and every single Tuesday, and you're going to hear about various initiatives surrounding this education and implementation. We're going to be calling you. We're going to be texting you. It's going to be in our broadcast. But just know it's because we love you, and there's nothing you can do about it. I mean that. And that I feel a great responsibility, not only for your souls, but for your safety. So I want to take you on this journey as we continue to be the Church Without Walls, putting the mission back in missionary. With these and other Tuesday segments, share this broadcast right now with your family, with your friends. And we're grateful for one of our partners in this effort, the Wellness Coalition, that's about to share an informational segment addressing one of many topics around the issue of COVID-19. Thank you for listening. Thank you for sharing. Thank you for supporting and being a part of these and other initiatives as we again aim to be God's church, putting the mission back in missionary, showing and sharing that love. And I thank you for it. God bless you. God keep you. Let's get this information.
Hello, everyone. Today we're going to talk about COVID-19 while you live with an underlying chronic disease. I am one of your hosts, Ms. Shady Ramus. I am the Reach COVID Flu Vaccination Promotion Coordinator here at the Wellness Coalition. We will also have Candace Parker, one of our community liaisons, sharing as well. So a little bit about our COVID flu vaccination project. We discussed the importance of the vaccines as well as vaccine hesitancy in the surrounding African American communities. The purpose of this project is to improve COVID-19 vaccination coverage as well as flu vaccination coverage among our priority population within 42 census tracts of Macon, Montgomery, and Loudoun counties. We also put together vaccination clinics in those areas. So a lot of people wonder, what is COVID-19? COVID is a very serious respiratory virus. Some of the common signs and symptoms are fever, cough, chills, achy body, loss of taste or smell, and difficulty breathing. But those are not all of the signs and symptoms someone may have if they have COVID. It varies with each case. So here are a few things you need to know. Adults of any age with a chronic medical condition can be more likely to get severely ill from a COVID-19 infection. Chronic diseases are defined broadly as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living or both. Severe illness means that a person with COVID-19 may need to be admitted to the hospital if they get the virus. They may need to be admitted to ICU or put on a ventilator to help them breathe. In worst case scenarios, they may even pass away. Chronic diseases such as heart disease, cancer, and diabetes are the leading causes of death and disability in the United States. Most chronic diseases are caused by key risk factors. Some are poor nutrition, tobacco use, also secondhand smoke, and lack of physical activity, excessive alcohol use, and substance abuse. Now I will pass it to Candace Parker.
I'm Candice, and I'm going to talk about some of the chronic conditions today. First, we have heart disease. Heart disease is any condition that affects the structure or function of the heart. The heart and lung work together in the body to maintain oxygenation. When the lung is affected by a respiratory illness like coronavirus, the heart may also be affected. The heart must work hard to pump blood, which may be even more difficult for someone with heart disease. Because all viruses take a toll on cardiovascular system, many can cause arrhythmia and even a heart attack. This is because the virus causes a severe inflammatory response in the body, and inflammation is the biggest cause of a heart attack. Some heart patients may have a higher risk of contracting the disease, and some may be more prone to complications if they get it. In addition, the virus can cause heart muscles or vessel damage, resulting in severe problems. Keep your blood pressure under control by eating well, maintaining a healthy weight, increasing physical activity, and managing stress. Continue to monitor and track your own blood pressure at home with a home blood pressure monitor if you have one. So it's important for people with heart disease and their caregivers to lower their risk of contracting COVID-19. If you have any form of cardiovascular disease, you should be more cautious about COVID-19, practicing social distancing and other ways to prevent yourself from getting coronavirus. Next, we have diabetes. Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. Your risk of getting very sick from COVID-19 is likely to be lower if your diabetes is well managed. Having heart disease or other complications in addition to diabetes could worsen the chance of getting seriously ill from COVID-19, like other vital infections, because more than one condition makes it harder for your body to fight the infection. Viral infections can also increase inflammation or internal swelling in people with diabetes. This can also be caused by high blood sugars, and that inflammation could contribute to more severe complications. Early studies did show that about 25% of people who went to the hospital with severe COVID infections had diabetes. Those with diabetes were more likely to have serious complications and to die from the virus. One reason is that the high blood sugar weakens the immune system and makes it less able to fight off infections. Patients with diabetes and COVID may experience changes in their blood sugars and medication requirements and benefit from more frequent monitoring of their blood glucose values. Patients may experience high blood sugars with infections in general, and this certainly applies to COVID-19 as well. So close contact with your healthcare team is needed to make sure you receive an appropriate treatment or insulin dose. Cancer. People with blood cancer may be at a high risk of prolonged infections and death from COVID-19 than people with solid tumors. That is because patients with blood cancer often have abnormal or depleted levels of immune cells that produce antibodies against the virus. Some types of cancers and cancer treatments can weaken people's immune system and can make them more likely to get very ill from COVID-19. Chronic disease and COVID statistics. Chronic disease represents 7 of the top 10 causes of death in the United States. 6 in 10 Americans live with at least one chronic condition, such as heart disease, stroke, cancer, or diabetes. Chronic diseases are also the leading cause of disability in the U.S. and the leading driver of the nation's $3.8 trillion annual healthcare costs. The COVID pandemic has resulted in personal losses with more than 500,000 lives lost. Death rates are 12 times higher for coronavirus patients with chronic illnesses than for others who become infected. Actions you can take: get vaccinated, continue your medication, follow your current treatment plan, have at least 30 days worth of medicine. When possible, keep preventive care and other routine healthcare appointments, have a shelf-stable food choice available, learn about stress and coping. Do not delay getting emergency care for your medical conditions. Call your healthcare provider if you have any concerns, and know your triggers. Staying safe. Now we'll watch a short video about staying safe with COVID-19.
Older adults and people of any age who have serious underlying medical conditions may be at higher risk for severe complications from COVID-19. This group includes people 65 years and older, people who live in a nursing home or long-term care facility, and people of all ages with underlying medical conditions, which include those with chronic lung disease and moderate to severe asthma, people who have serious heart conditions, those with severe obesity or a body mass index of 40 or higher, people with diabetes, those with chronic kidney disease undergoing dialysis, and people with liver disease, and people who are immunocompromised, including those going through cancer treatment, smokers, transplant patients, those with poorly controlled HIV or AIDS, and those who experience prolonged use of corticosteroids or other immune-weakening medications. If you are at higher risk for severe illness from COVID-19, take actions to reduce your risk of getting sick. Have supplies on hand. Take everyday precautions like washing your hands with soap and water. Avoid travel. Stay home as much as possible. Avoid all cruise and non-essential travel, and have a plan for if you get sick. If you have symptoms like fever, cough, and shortness of breath, call your doctor. Call 911 if you have emergency warning signs, including difficulty breathing, persistent pain or pressure in the chest, new confusion or inability to wake, or bluish lips. To learn more, visit cdc.gov/COVID-19 or coronavirus.gov. Let's work together to protect ourselves, our families, and our communities. Thank you.
Thank you all so much for watching this video. If you have any questions, please comment below. If you can't think of any questions at this moment, please feel free to email Candace or myself or give us a call. Thank you.